So this is the last slide in that presentation. And it said that the biological health-oriented dental practice is the largest emerging market opportunity in modern history. So this is in 2009, before there are any organizations about oral systemic health. And this was really a lot about my good fortune in having very early on a preventive-oriented practice. And I'll talk about that in a minute. And I looked out at the audience and I saw nothing but blank stares. There was no one that had a clue of what I was talking about. So basically, I have spent the 12 years since this presentation trying to explain that slide. So this is what I knew. I knew that that economic downturn in combination with this demographic tsunami called the baby boomers, I knew that there was going to be a change in behavior, much like there was a change in behavior during the Great Depression. And I knew that conventional dentistry, which has all of these features here, I knew there was an opportunity that was going to emerge for a health-oriented practice, which was very much how I had practiced since 1989. And this practice here is more patient-centered, more holistic, addresses underlying causes, it's biologically based, it's personalized, and it's preventive in nature, and it's not reactive. And so the surveys at the time, talking about what concerns boomers, the three things that concern people are brain health, event health, and mobility. Now, if any of you have been touched by dementia in any form in your family, it will make an impact on you. My mother was in dementia care for a decade, and it's the most brutal thing. It's just incomprehensive how intense that it is, right? So I have a healthy fear of that, okay? There isn't any question about that. So, but what's interesting that we've known, that we've come to know since 2009, is that all of these events have a relationship in the mouth. So boomers are looking for quality of life decisions, and where they are spending their dollars is anything anti-aging, anything related to mobility, and anything related to brain health. So here's the opportunity that I was attempting to explain in 2009. If we could address the connection between the mouth and overall health, identify early risk factors, diagnose and treat at the earliest stages, and provide patients with personalized individual treatment plans. And the new role of the dentist and the new customer experience is this: we become a partner in managing health issues rooted in inflammation. And those case studies that Tasha showed tonight, those were just such fantastic case studies to show how inflammation presents itself and how it can be resolved orally. So these are all related, rooted in inflammation: heart disease, stroke, diabetes, Alzheimer's, rheumatoid arthritis, and certain cancers. So what I want to talk tonight about in my brief presentation is the new customer experience. So this is a film clip a long time ago with Steve Jobs at Apple Computer. And at the time, he was in a lot of trouble. Apple Computer was losing $1 billion a year. That's with a B. That's incomprehensible today, but that's what was going on at the time.
And one of the things I've always found is that you've got to start with the customer experience and work backwards to the technology. You can't start with the technology and try to figure out where you're going to try to sell it. And I've made this mistake probably more than anybody else in this room. And I've got the scar tissue to prove it. And I know that it's the case. And as we have tried to come up with a strategy and a vision for Apple, it started with what incredible benefits can we give to the customer? Where can we take the customer? Not starting with, let's sit down with the engineers and figure out what awesome technology we have, and then how are we going to market that?
So the first thing that I thought about when I saw that, so last weekend was Sorona World in Las Vegas, and I started thinking about CERAC. And CERAC is a perfect example of what Steve Jobs was talking about, a technology that they were looking to find a home for, okay? There has never, ever been a demand for same-day crowns from the consumer, ever, okay? That was created from the technology. The opposite of that is the focus on the customer experience. So this is a survey in Dental IQ magazine that talks about a recent dental patients grading their experience in the dental office. Now, this does not surprise me because dentists always think more highly of what they're doing than the actual reality. The dentists scored terribly in this on the patient satisfaction. And so I started thinking about that film clip and I said, let's go back and let's look at this. Benefits to the customer, benefits to the patient. What incredible benefits can we take to the customer? Where can we take the customer? Let's shift our orientation. And I came up with two things that I want to talk about very briefly tonight. I want to talk about cost and savings, which we rarely talk about, and longevity and improved health. So I came up with a new value proposition. I like to do this from time to time. And it says that my goal for you, Mrs. Smith, Mrs. Hairdresser, is for you to spend the least amount of money as possible for your dental care long-term and improve the health of your mouth, which supports overall health. So I want to take that statement and I want to break it into two parts. Improve the health of your mouth. And as Tasha showed, that conversation is predominantly about the salivary microbiome. And it's something that for some reason, dentistry has just not embraced. And I really cannot tell you why. But this is basically everything you need to know in a nutshell. And I use the word dysbiosis. Okay, the first time I ever heard about dysbiosis was about gut health and leaky gut and dysbiotic bacteria. I rarely hear dental professionals talk about dysbiosis. And all dysbiosis is a shift from health to disease. And there are factors, both internal and external, that cause that shift. And when you have that shift, you have an increase in pathogenic activity. And when you have an increase in pathogenic activity, you have an increase in oral infection, dental caries and periodontal disease, and you have an increase in systemic disease. That's as simple as I can possibly make this. So let's look at the other part of that statement, which supports your overall health. That's the oral systemic connection. Changes in the oral microbiota promote development of systemic disease, cardiovascular disease, diabetes, Alzheimer's, certain cancers, arthritis, pregnancy complications, and respiratory complications. If you have never seen this quote, please write it down. This is one of my favorite quotes. It's been on my desk for 20 years. Anytime I have a problem, I come back to here because this quote usually solves that problem. People don't value what they don't understand, and people don't buy what they don't value. And this is what I call the 10X value proposition. What the veterinarians have done to the dentist is absolutely embarrassing as far as the oral systemic conversation. So a couple of years ago, my wife and I were having lunch with a couple, and the wife had just come from the veterinarian, and she takes out her phone and she wants to show the picture of her dog that just had a laser cleaning, and a laser cleaning to the tune of $750. And my mouth just dropped open. And I got to thinking, you know, the average PPO price in America is probably $75. And this was a 10X value proposition. This woman was not complaining. This woman was thrilled. And the reason she was thrilled was because she valued what had been explained to her, okay? And she bought what she valued. And the veterinarians have done this for a very, very long time.
You know that maintaining a healthy condition of your dog's mouth could increase their lifespan by up to 1/3?
Now, that was a little TikTok that I saw. What I want you to do is I want you to grasp that concept of 1/3 of a lifespan of a pet. okay? And this
Did
is
you
what
know that
this is what immediately came to my mind. So this is Paul Keyes, and this was my mentor. In 1989, I met Paul, and he put me on this direction that you know I'm currently on. The things that he did as a researcher are unparalleled. Paul passed away a couple years ago at the age of 100. And I got to thinking when I was doing this presentation, the average life expectancy is about 76 in America, and he lived 1/3 longer than the average life expectancy. And he did that because of his knowledge of a healthy oral biofilm and baking soda and hydrogen peroxide, okay? Now, to make that even more interesting, his wife lived to 101, and that's 1/3 more than the average life expectancy. I think that's interesting. Okay, so we're going to talk about the quick win and business principles that are universal. This is an article in Inc. magazine, and it says why establishing quick wins is critical for leading change. Dentists are notoriously horrible at leading change within their organization, and there are exact reasons why, and there are exact reasons why the video microscope works, okay? And I'm going to show you that. But first, I'm going to show you what does not work. This is what a quick win does not look like. So this is a collaboration of the AAP and the European Periodontal Society. And in 2018, they came up with this collaboration with all of these charts, with definition, staging, grading, whatever. I think I counted like 120 different squares. So if I know that my hygiene department is deficient, and I decide that I need to move them in a direction, and I print this off, and I call a team meeting, and I hand this out to every member, and I say, people, we have to do a better job. My chances of moving the needle, and I'm just talking about myself, in that particular instance is pretty small, okay? Now, there's an actual Facebook group that is dedicated. They took this grading system and they made it in the color, and that's all they do is to talk about this grading system, the staging and grading. Here's a picture from their Facebook group. Here's the monitor where you're doing your diagnosis from your x-rays and then referring to this chart. And I don't know, that just, it doesn't work for me, right? This is another post off of another Facebook group. And this is an attempt at a hygiene scorecard with a risk assessment of low, medium, and high. First thing wrong with this is it's not biologically based, okay? Risk assessment has always been biologically based. So this talks about gums that are pink being low risk, red being medium risk, red, purple, puffy, say that 10 times, being high risk, okay? This has no chance of being incorporated into practice because you can't calibrate people. It's 100% subjective. No dry mouth, somewhat dry mouth, very dry mouth, okay? That does not work. And it doesn't work because Galileo knew from a long time ago that you measure what can be measured and you make measurable what cannot be measured. That's pretty profound. And this should be a quote that most dentists need to learn, okay? So this is the protocol that Sue helped me to kind of sharpen and hone. And she named it the Larkin Protocol. I did not. I'm much too humble to name something after myself. So you need to know that. So there are 2 diseases, periodontal disease and dental caries, 3 levels of risk, low, medium, and high, and there are 4 modalities. The 4 modalities are, we're going to test patients, we're going to teach patients, we're going to treat patients, and we're going to repeat. And that's your recare interval, okay? It's that simple. You do not have to make this more difficult than that. Now, I needed to put this in here because the first question that comes out is, especially with the hygienist, is I can't do anything additional. I have 0 time in my appointment, 0. And if this was truly additive, it would not work. I am in 100% agreement. But I'm going to tell you that what I'm going to show you tonight will save you 15 minutes. And here's how I'm going to break it down, and I'll prove it to you. The first thing is in check-in. Now, because of COVID, where we went to this deal where the people were in the car and they come right back into the room, and all the paperwork is in the cloud. One of the things I noticed was, that's a really great procedure. That's 5 minutes, okay? Because the hygienists are always complaining about paperwork and that gathering of paperwork in the reception area. And so I told our operations girl when COVID looked like it was going away, it wasn't, but it looked like it. I said, we're not going back, okay? We're going to continue to do check-in. Microscopy, now I'm being conservative. I'm saying 5 minutes, okay? It's way more than 5 minutes. When you put that bacteria on the screen and the people see it and they say, whoa, wow, what am I going to do? Okay, it is no conversation on pockets, no conversation on bone loss. And then the third thing is guided biofilm therapy. And I'm going to show you just a very brief video clip of guided biofilm therapy. So this is side-by-side airflow therapy next to conventional scaling. Now, first thing is disclosing. Okay, I'm going to show you something really cool here on disclosing. Why do we not disclose? The reason we do not disclose, because I think disclosing, back in dental school was a cool thing. It's because if you show a patient a mirror after you're finished, they will always find something that you missed. Like, what's that, right? Well, in guided biofilm therapy, using the airflow, the disclosing agent is actually your guide. You remove all of it with the stream of the erythritol and the fluid, right? Now, I understand that, most people don't do scaling like this. You're probably using a Cavitron. But what they're wanting to show here is a side-by-side comparison from a time standpoint of this approach versus a traditional, let's say it's a Cavitron, flossing, Prophy cup. And so they looked at it side by side. And you'll see that the patient's left side is already finished, okay? And like I said, very few people kind of pick away at that. But I'm just using this as an example, okay? So, and then I'm going to show you this in just a second. This is really cool because I'm going to stop this. Okay, let's say that you did this traditional deal, and now we're using the Prophy cup, and you're finishing up. And once again, remember I told you, you disclose this patient because you're really wanting to do the right thing, right? And now you rinse, okay? Now, look at right there on that central incisor. You see that blue thing? If you handed that patient a mirror when you were finished with this, that patient would go right there, okay? And say, what's that, right? That's why people stop disclosing it, because there are little tidbits left behind. You do not see that in GBT, okay? That does not happen in GBT. Same thing here. When they do the lower, you'll see little bits and pieces of disclosing between the centrals. Now, here's the conclusion, okay? Airflow was 8 minutes, 30 seconds, and the traditional was 28 minutes, whatever, okay? 20-minute differential. Now, let's say that this is pure propaganda from EMS trying to sell this unit, okay? So what I'm saying is if they say it's 20 minutes, I'm saying I promise you it's 5. I promise you it's 5. And that's where I got your 15 minutes, okay? Now, what do you do with those 15 minutes? What do we do with those 15 minutes? What I want you to do is to cram as many patients into the schedule. No, I'm just kidding. I was trying to see if you're paying attention. We use that for teaching. Test, teach, treat, repeat. The teaching is the bonding. It's where the value is created. That's the $750 dog prophy, okay? That's where it's at. That's what you do with the 15-minute. Okay, so let's look at the quick win. I got off the track a little bit, but I wanted to show you about that time thing. What the quick win does, it gives the team something tangible. It gets them energized. It validates the new way of doing things, and you have near-term strategic achievable goals. Okay, now Sue has made up so much materials. So what she's done in our training is created this thermometer, and the goal is to at least do 100 biofilm samples. And the idea behind this, and it's almost like a contest in the office. If you do 100, you probably have seen everything that you need to see to get a comfort level, right? And so that's one of the objectives when we do the training is to do 100 samples. Now, this is Sue at ADX earlier this year. The audio on this is not perfect. I don't need the audio. Over here, I have the words energy, tangible, new, innovative. This is a dentist looking at a biofilm for the very first time. And I want you to look at this, and I want you to hear him say, I need to get rid of this. How do I do it? Because that's what patients are going to say over and over again when they look at their biofilm. Unmute. There we go.
It's pretty confronting.
So is me? How many people have intraoral practice?
Lots.
Okay, this is intraoral on steroids.
Yeah.
Watch his body language.
What was that?
Now, if you talk about dental microscopes, this is a real dental microscope. Oh, yeah, yeah.
That's your fault.
My brother.
I'm my 45.
Oh.
We are.
Oh, look at the thing.
Look at it.
Look, so you're a patient. You're a patient, right?
Yeah.
And you just saying, can you tell me what your initial reaction is?
My God, I need to get rid of this. How do I do that?
Bingo. Look, how do we get rid of it? Now, I'm going
This
to
is fantastic.
And he has spirochetes on top of it.
Look at my little lens.
look at my little. Oh, and we've got sparky.
No.
Anyway, that tells you everything to know as far as the definition of a quick win. That is a quick win. This is one of my favorite marketing books. Russell Brunson is kind of a big deal here in America. ClickFunnels is his invention. Expert Secrets is his book. He has a word called the Epiphany Bridge. The Epiphany Bridge is engaging a person emotionally so they have a desire to move forward. Now that we can go back and revisit disclosing, which I like, because now we're doing airflow, this to me is the Epiphany Bridge. It's the patient seeing the biofilm on the screen, and we've recently gone to like 65-inch monitors. I just can't get it big enough, right? I like it. I like to make an impact. You go from that to here, and you show them the dye on the teeth. This is the bacteria. These are the living bacteria in your mouth. This is what they look like on your teeth. I think that is such an incredible, and as he says, an Epiphany Bridge, that it's just an absolute no-brainer. Now, one more comment on that emotional movement. So this is me, 1995, teaching at Creighton University. And this is my brochure back at the time, Modulated Microbiological Periodontal Therapy. This is Dr. Scott Cairns. He contacted me 2 years ago and said, do you remember me? I said, yeah, I remember you. I think he might've been class president. He was a sharp guy. He said, we wanting to introduce the microscope into our practice for a variety of reasons. We've tried it, we can't figure it out. Can you help me? I said, absolutely. I said, I can probably do it in 5 minutes over Zoom, but I want to come out to your practice and I want to meet you and I want to meet your family. So I went out to Colorado, and what I found out since is that he is a big deal. He's a big deal in Pacific Dental Services, which is a large dental corporation, top producer in the top percentile. And they did a 3-month pilot program using the microscope. They were looking for two things. They were looking for acceptance for laser therapy, which is out of pocket, and acceptance of biofilm DNA. And I think they're one of the largest users of biofilm DNA testing in the country. And within a week, Scott wrote this in a blog. I think this was an internal company blog. The evidence of pathogens swimming and swirling directly in front of the patient has the most significant emotional impact I've ever seen in patients. Now, coming from him, this was really significant because he's a player. Okay, so I'm finished. I want to give you some contact information. If you want to follow up on anything, tomlarkin.com. If you want to set up with a call with Tasha and myself, if you want to move forward with any of the things that we've talked about, my email is tom@tomlarkin.com. The website oralsystemicmastery.com is where our live events, if you want information about our live events. Tosh and I will be having a live event in the spring. We were going to do it in the fall, but COVID kind of gave us the willies. So we kind of postponed that until, but I think we're going to probably be doing that on a regular basis. And that will be guided biofilm therapy, laser therapy, and microscopy combined. It's a great concept for you to kind of come and kick the tires and look at these technologies. There's a private Facebook group called Hygiene Hackers. Join that group. These are all like-minded individuals. We have a new study club that's just going to be coming online soon called hhstudyclub.com, and that's Hygiene Hackers Study Club. And that's going to be more of a deep dive. And then we're going to talk about ozone in a minute, dentalozonewater.com. So the electrolytic ozone water that everybody's using in Australia is now going to become available in the United States. Sue had sent me some samples of some devices, and I'm going to be an advisor to BioSure here in the United States because we use ozonated water in our practice, but we make it in a conventional manner. This is a whole different ballgame. And I'm going to ask Dr. Pang to talk about that a little bit too. So this is not live yet. It will be in the next couple of weeks. So you might want to bookmark that as far as ozonated water, which we're going to talk about.